we'll get started. You'll probably hear an echo once it starts on YouTube, and then we'll get started with introductions. Okay, I've shut off my own YouTube so we don't have the echo. Good morning, everyone. Sorry about the delay. We had a couple of people that were having some issues connecting. So good morning and welcome to our first medical advisory meeting in about 9 months. Our committee has stayed basically the same with our doctors. I would like, maybe just as a refresher for anybody watching, Dr. Lochner, Dr. Geyer, Dr. Michael, could you just maybe provide a little bit of introduction about who you are, where you work, just in case anybody who has not been with us before doesn't know about your background a little bit. Dr. Lochner, do you want to start?
Sure. I'm Dr. Jennifer Lochner. I work with UW Health's Belleville site. We're a family medicine clinic. I'm the medical director here. We're also a teaching site. So we have a practice that provides medical care and also education to students and residents.
All right, thanks, Dr. Lochner. Dr. Geyer, you're the next up on my screen.
Hi there, my name is Lindsay Geyer. I am a pediatrician. I've been with SSM Health through the Monroe Clinic for the last 18 months. Prior to that, I was at UW. I'm involved with the family medicine residency program here. I'm in charge of the pediatric curriculum for them. That's through the University of Illinois. And I also provide a lot of education, residents, and medical students. And I've been a pediatrician since 2010. So I'm happy to be here. Thank you.
Thank you. Dr. Michael, you're the next up on my screen.
All right. I'm William Michael, go by Billy. I'm also at the Belleville Clinic, a UW Health Clinic, and faculty with the family medicine residency at UW. Before that, I was a Navy physician, and I started at the clinic maybe 2 years ago, right after I finished in the Navy. And I've been a family medicine physician since 2015.
All right, thank you. And then Laura Anderson, who has been a part of this group in the past, is on vacation, couldn't join us. But as we go through our agenda, we did get some input from Laura Anderson as well. What I'd like to do to start, and I will try to share my screen here, is just to provide an update on where we are at with local cases, and then our vaccination numbers in the district. For those of you that are on our Zoom call, can you see this screen? It might be a little smaller, but can you see that okay?
Yes.
Okay, so probably the easiest way to look at our numbers is on the left. You'll see School District of Belleville, and then there's our census tract. And then, as you remember, going way back, sometimes we were looking at the area around us: Belleville, Brooklyn, Monticello, and New Glarus. So as you probably know, we had very few cases from May until really about the third week of July. And I've tried to document that there for school district census tract, and then the 4 tracts that I mentioned, 0, 3, and 17 cases. In the last, less than a month, you can see that those numbers have certainly ticked up from 0 to 9 in the school district, from 3 to 7 new cases in the census tract, and then from 17 to 38 in that 4 tract. And that's up to date as through yesterday. Vaccination status, again, this is all available online through DHS. In the school district of Belleville, which is about 5,800 residents, our number or percentage of residents with 1 dose of vaccine is 65.8. And then a complete series, you can see that here, just ticked up to 63%, I think, within the last 2 days. And you can see that percentage here. So I wanted to give you, again, just an update on where we are at in terms of COVID cases, and then our vaccine data as well. What I'd like to do is to hear from the doctors about potentially what you're seeing in hospitals and clinics right now, potentially in terms of COVID or other things that you're seeing. We are getting reports on other airborne viruses besides COVID as well. I'm not sure, again, Dr. Lochner, do you want to start?
Sure, we are seeing a lot of respiratory illness right now, not necessarily all COVID, and I think that's part of the concern. We actually do some tracking for respiratory viruses for the state of Wisconsin, so we swab anybody who will let us swab them. So we find RSV, we find parainfluenza, we find rhinovirus, we find other non-pandemic coronaviruses, all sorts of viruses that actually don't often hit us in the summer are hitting us right now. And so we're seeing a lot of sick people, adults and kids. I don't know the latest hospital numbers. I think I checked yesterday and it was 27 in the Madison area hospitalized with COVID illness. At the peak last winter, I believe we were around 100. So it's not zero, it's not 100, but it's on the uptick. So I think folks are pretty concerned about the trajectory at this point.
Dr. Geyer, anything to add about what you're seeing in your practice right now?
Absolutely the same as Dr. Lochner mentioned. Usually this is sports physical season and we're busy with that. So right now it's essentially a respiratory virus like the middle of winter plus sports physical. So it's been very, very busy. So very unique year.
Dr. Michael, anything to add about what you're seeing?
Sure. Yeah, I mean, I'll see a lot of the same things that Dr. Lochner is seeing. But I looked at the American Family Children's Hospital just to get a sense of how many patients they had. And again, this is all comers, but I rarely see that hospital full, but they were red as far as like census numbers. They're usually green. So that was a little bit of a shock to me, especially in the summer and not the winter.
All right, thank you for your input on that. What we would want to do at this time is to look at, and I'm sure you're aware of these, the recommendations that have come forward more recently. There is a recommendation from the CDC that came out late last month, as you know, that calls for universal masking for all teachers, staff, students, and visitors to school, regardless of vaccination status. One thing that we've already put out to parents in our letters, both mine and then the principals that went out earlier this month in August, is that the CDC does require, it's not a recommendation, it's a requirement that we have masking on our buses, public transportation, at least through September 13th at this time. We're looking to see if that stays, will be extended, what they do with that. But right now that's through September 13th. I'm sure you also know that Public Health Madison-Dane County has adopted those same similar CDC recommendations. And we'll talk a little bit here in just a minute about their quarantine policies and how that might affect, well, if we talk about a recommendation today, how that might affect what happens in our schools. As you also know, I'm sure you talked about your work just at the start of the meeting. The American Academy of Pediatrics came out with a very similar masking recommendation. And then just recently, the Department of Public Instruction came out with a similar recommendation as well. And again, those are all available online. We're usually really efficient in our meetings. We've talked again about where we are locally, what you're seeing. You obviously know about the recommendations. What I'd like to do is to show a screen quickly and just to give some perspective about what schools will be dealing with this year. And this is from, here we go. This is from our Dane County Public Health Department. And I'll just bring you to this area where it talks about contact tracing in combination with isolation and quarantine. And in this second paragraph here, you'll notice that it says, if all individuals are masked, a modified quarantine allows for all individuals to forego quarantine in order to attend school, regardless of vaccination status. And so what public health has done in Dane County is they have incentivized two things, masking and the vaccinations. So before the orders were lifted June 2nd, this last spring, early summer, where if we would have a positive case with staff or students in the district, anybody that was considered a close contact would have to quarantine. Now we've changed our school district quarantine policies to match CDC. So there is the quarantining, or excuse me, the test after 6 or 7 days and coming back after 7 days. That's an option that we didn't offer last year. But what this does then is if we are in, as you know, if we are in an all masked environment, there are no close contacts unless that student or staff member is showing symptoms. Also, if we were in an unmasked environment and any close contact would be vaccinated, that person again is no longer considered a close contact. So I believe that you are all aware of that. Are there any questions at this point on what the schools are dealing with in terms of what our public health department has put out? No questions on that? So I'll just get right to it then. Dr. Geyer, when I sent out the invitation, you had accepted the invitation and provided some feedback right away. Would you like to start? And then maybe I'll follow up with Laura Anderson, because Laura Anderson had supported your, couldn't be here today, but had supported your stance that you had shared in the email on the invitation.
Yeah, absolutely. I mean, I told you coming into the meeting that absolutely my recommendation would be universal masking. A big important piece of all this is we know kids benefit from in-person learning, and that absolutely should be our priority. And the way that we know that that can happen is if that there are proper safe mitigation measures in place. We know this is best on a layered approach, in addition to the ventilation upgrades that you guys made and the hygiene practices and the 3 feet social distancing. Universal masking is a huge piece of that. So I had said prior to the meeting, I'm happy to come, just so you know, this is going to be my recommendation, universal masking. This aligns with the CDC, of course, public health. A couple other points that I have kind of made to other people is this not only helps with the prevention of COVID spread, but we know that masks work from just a respiratory virus standpoint in general. When we were seeing universal masking, we definitely saw, we didn't see the typical winter respiratory viruses. Once the masks were lifted, as Dr. Lochner mentioned, we're seeing a ton of, RSV has never been a summer virus. So we're seeing a lot of common cold viruses, RSV. And as of right now, I mean, those kids with normal common respiratory viruses should not be allowed in school. And remember, most kids, depending on their age, are going to get on average about 12 respiratory viruses per year. They each last 10 to 14 days. Typically in the past, you've always been able to go to school with that. Just in this pandemic world, no one should be going to school with common cold viruses. So in addition to prevention of COVID spread, the masks will prevent these typical standard upper respiratory viruses as well. So not only are we preventing COVID, which is of course incredibly important, but we're preventing the spread of those other diseases, and that will keep kids in school. So without universal masking, people need to keep in mind that their kid with a common cold is going to be out. Your kid will be in school more, whether it's COVID or not. Your kid will be in school more if we're practicing universal masking.
And again, I'll just add that when Dr. Geyer had responded that she was coming to the meeting and said that she would have this stance, Laura Anderson, who couldn't make it today, was on vacation, did send back a message that said, I'm on vacation, will not be attending. I completely agree with Dr. Geyer's recommendation and rationale. Dr. Lochner, recommendations, if any?
I just fully agree with Dr. Geyer for all the reasons that she stated, and agree with the CDC and the AAP, and the Pediatric Infectious Disease Group nationally has come out with the same recommendations.
Dr. Michael, recommendation, anything that you'd want to say at this point?
Nope, I don't think anything different. I would say, in medicine, we kind of talk about standard of care a lot, and that's kind of making sure that you're making recommendations to patients that align with kind of what normal practice has been established. And I would say with essentially every major group recommending universal masking, it would be irresponsible to recommend anything but. And I agree with everything that Dr. Geyer said as far as the rationale behind those recommendations.
So just to be clear, I was tasked on Monday at our Monday night board meeting with getting the medical advisory back together. And I always just want to be very clear with what I'm hearing to make sure that I'm not hearing something different if I bring anything back to the board. So I'll just put you on the spot. What I am hearing is that we are asking that the doctors are recommending for universal masking in our schools to start the school year. I'll have a few follow-up questions on that, but Dr. Lochner, am I hearing you correctly on that?
Yes.
Dr. Geyer, the same?
Yes.
And Dr. Michael?
Correct, yes.
If I could, and again, the principals and I would need a little bit more, is the recommendation, and again, I'm not trying to put words in any mouth, when you say universal masking, would that be K-12?
Yes.
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 Another question that we may have then is, would you be recommending, if there is masking, last spring, public health was specifically in their order requiring a 2-ply mask. And as you can see in a school environment, we may get bandanas, we may get gaiters. Would your recommendation be the same as what we had in the spring with a 2-ply mask?
Yes, that would be ideal.
The data is best for those better masks, yes.
Yep, agree.
Okay.
Mr. Perry, can I ask a follow-up?
Yes.
We said K-12. I just want to clarify, we do have 4Kers in our building too. Would you recommend that for our 4Kers too?
Yes.
Okay, thanks.
Same for you, Dr. Lochner, just to be clear. Dr. Michael?
Yep, correct.
Thanks for the clarification, Mrs. Schmidt.
Actually, Nate, can I add to that? And would that include staff as well?
Correct, everybody.
Yes.
Yep.
Dr. Michael, just to be clear on that one too?
Right, yep.
Okay. Another question that has come up, I have not seen any recommendations on any masking outdoors. Even when I was on recent statewide calls with Dr. Westergaard, would this be a recommendation for masking indoors only?
That's a great question. I would recommend for definitely indoors, depending on what the levels do in the Belleville School District. We would potentially consider outdoor masking, but I think right now I would favor in person unless we have data to suggest otherwise. I guess I'm curious, Dr. Lochner and Dr. Michael, if you have any other thoughts on that.
I mean, my understanding of the data is that outdoors masking is less important unless it's a real crowded kind of scenario. And I guess I'm not familiar enough with what outdoor school activities look like to give much of a direct statement about the close contact that occurs between kids outside, I guess, for example, at recess. That's a more nuanced decision, I think.
Yeah, I think most of the data that they've been tracking and the recommendations are made for indoor spaces. So, I mean, we try to keep our guidance as much as we can to kind of the evidence that's available to us. So I think that the indoor masking is kind of the most important thing. And then, as far right now, I don't think that there's a specific outdoor guidance. So I would think that recess and things like that, it's less important to be masked, but certainly indoor masking is probably what we should stress here. And then as more data becomes available, we should revise that or make different recommendations.
Could we just pause for a minute? I have gotten 2 emails that usually do not check email during a meeting, but my phone buzzed just now. Would there be maybe Mrs. Schmitz or Mrs. Schmidt? Can you check if we are still live on YouTube? Our feed does say that we are live. That would be the district YouTube.
Mine is, I've had it up just kind of in the background. It's just spinning right now.
Okay.
Oh.
It is working? Okay. I just wanted to double check that we were still on. Thank you. It does not sound, just to be clear, that there's a specific recommendation for outdoor masking. It would be indoor masking only at this point. Dr. Lochner, Dr. Geyer, Dr. Michael, is that accurate in your view?
Yeah.
Correct. And that's my understanding of the CDC guidelines right now too. The universal masking in schools indoor. They don't have a stance on outdoor masking right now. So I think that aligns with everything we just discussed.
Yep, agree.
And Dr. Lochner?
Yes.
Okay. I think the last thing that that would be a question for us is we do have then staff back on the 23rd. Would that be your recommendation? And then we would have some student parent nights later that week. Would that be your recommendation that we would start when we have those groups back into the building then on the 23rd of August?
Yes.
Yes, that would be my recommendation unless they have a single office, kind of like myself right now. I'm at my clinic, I'm in my own office, I've got my doors shut, so I'm not wearing my mask right now. So in those instances, I think unmasking is absolutely fine. But yes, when there are two people in a room together, absolutely they should be masked.
Dr. Michael, the same on the start date then? That would be for when we have staff back on the 23rd?
Correct. And then just to be clear, at the University of Wisconsin and Belleville Clinic, we have never stopped doing that. So for this would be much more of the same, but certainly I think that aligns with the CDC guidelines.
And we had things very similar in the spring before June 2nd. If a teacher, for example, was working in their classroom on their own, they could close the door, take their mask off. Okay. I think the last thing before we recap is we do have another school board meeting on the 13th. If this recommendation goes to the school board, let's say before that, would this committee be willing, and I know Dr. Geyer, I'm kind of going off of what you had said earlier about revisiting this and looking where we're at. Would this committee be willing to get back together before each monthly regularly scheduled school board meeting? Again, typically we're on the second Monday of a month. So that would be probably the week before that, just that we would have an updated recommendation on when, if the school board were to adopt your recommendation, that then there could be a recommendation in the future that masks would be no longer required. Would you be open and available to that we can meet before our regular school board meetings then?
Probably.
Yeah, probably. I don't want to commit to monthly meetings at the moment, just advising for other schools. I likely could be available. If there are apps, if we have zero change in our stance, I don't know if that would be worthy of all of our time. Maybe an email beforehand, just saying, have there been absolutely any changes? If we have new data, I think that would make more sense to get 3 physicians back together prior to clinic. So I guess likely, but I don't want to overcommit. I'm working on that.
Sure. Dr. Lochner?
I kind of agree. If the evidence is unchanged, I'd prefer kind of an email vote, but if it's really necessary to do this in person, I can figure out how to make it work depending on the week.
Yeah, and we do. For those maybe watching on YouTube right now, this is all on their own time. We had asked them as local doctors to participate back in the fall. They had agreed to do that. They're doing again this at 7 a.m. on a Thursday morning on their own time. So we appreciate that. If I could just recap of what those recommendations are, just in case we did loop on YouTube and it did not come through very well, and then just have the doctors concur with this. The recommendation unanimously, I believe, was for pre-K 12 masking plus staff, 2-ply masks, at this point, indoors only, with a start date of August 23rd. And we would revisit this potentially by email or in person before regularly scheduled monthly board meetings. Dr. Lochner, can I just maybe go around again? And is that your view on what we just talked about and your recommendation?
Yes, it is.
Dr. Geyer?
Yes, if parents want their kids in school, this is the way to do it. Absolutely.
Dr. Michael?
Yep, that is accurate.
Okay. Well, again, I want, first of all, is there anything else from medical personnel on, or Director Johnson or Principal Schmidt or Schmitz? Any other clarifications necessary? Okay. Appreciate everyone's time this morning. Again, we always try to be efficient. And again, thank you so much for getting together so early on in the morning.
Absolutely. Thank you. I think you guys do a great job in Belleville.
Yeah, appreciate you guys.
Yeah,
Thanks.
great job.